Hi guys, welcome back to my channel. Today I am here to present you with a topic that is menstruation on this very special day, 28th of May, Menstrual Hygiene Day. Okay, so let's start with menses. What do you mean by menses? What is menstruation, or we say periods, or we can say the normal blood, okay, which is often taken as the pathological section or any disease kind of, okay, as our society is. So let's break the taboo and let's aware the society that menses is absolutely normal. Okay, let's start. So menses is the periodic discharges from the female genital tract. What is being discharged actually? It is the discharge of blood with some of the materials like the unfertilized ovum, okay, the endometrium shedding with fibrinolysin or prostaglandin. Like these are the hormones which are being usually shed with the menstruation blood. Okay, then how much amount is there? That is of 40 ml. Okay, then duration is 4 to 5 days, and the days is 28 days plus minus 4 to 5 days. So we can think of like 4. Okay, so 4 is like 28 days plus minus 4 days. Amount is 40 ml, so it can be 4 to 40 ml. Okay, and then again we can think of a rule 4, that is it lasts for 4 days. Okay, 4 days, but it's like we can think that it is the minimum one. What do we mean by menstruation cycle? When this process is in continuation per month occurring in females, then we say it as menstruation cycle. Okay, so these are the basic things which I wanted to again revise it with you. So one question: which blood is the menstruation blood, whether it is the arterial blood or whether it is the venous blood? So please comment it, and I will say this in the next video. Okay guys, do you know every woman has different cycles? Okay, some are having for 28 days, some are having for 35, 40, even less than 28. Okay, so I will discuss some of the drugs in Materia Medica which will be very helpful in our day-to-day life, in prescribing, and even in examinations. Okay, so let's start. As we have studied that some of the menses are very early, some are very late, some are very scanty, some are profuse, some are regular, some are irregular, intermittent, paroxysmal, spasmodic pains, and lots of concomitants and lots of associated symptoms are there, which the patient comes to our clinic and tell. Okay, so we have to deal with all these problems and we should not neglect any one symptoms. Okay, so let's start with the first one. So I would like to mention you some of the drugs in some different headings. Okay, so let's start with the first heading, that is profuse. That's some of them. So I will say like ammonium carb, calcarea carb, cyclamen, ferromet, helonius, laccan, creosote, then ipecac, macphos, medorinum. Okay, then we can again continue with millefolium, murex, nux vomica, platina, sabina, stannum, sulfur, tuberculinum, and trillium. I think I have got all these in profuse one. Okay, next we can move forward to the black color one. Okay, the black color menses. So there are lots of drugs, but I have listed some like crocus, then magnure, then nitric acid, sulfuric acid, muriatic acid, and crotalus. Okay, so this comes under black heading, like the color of the mens. We'll move to scanty section. In a scanty there is pulsatilla, conium mac, graphitis, lachesis, and lilium tigrinum. Okay, next we'll move on to amenorrheic condition. Like see, there are lots of drugs which will cover amenorrhea also. In fact, the drugs which I have named in this profuse scanty, that will also cover amenorrhea, but specially mentioned is like aconite, epocinum, podophyllum, which I have got. Next we can think of, next we move on to metrorrhagia. Metrorrhagia is epocinum, Okay, so in metrorrhagia there are drugs like epocinum, argentum nitricum, crotalus, magmure, medorinum, thalsp, trillium. Then we move to next section, that is vicarious menstruation, where there is something else discharging instead of menses. When menses should occur, that is stopped, but something else is being discharged. So these drugs cover brynia, crotalus, and hemamelis. Okay, the menses which occur in day is pulsatilla. The menses which occur in night is bovista, maccar, magmure. Now moving on to next section, that is amelioration by lying down. That is menstruation is ameliorated on lying down. That is cactus, causticum, lilium, and bovista. Then there are also drugs which is uh, telling that there is discharge of blood between periods. Okay, so these drugs are Vovista, Borax, Cocculus, Sabina, Ambragracia. Then we'll moving on to drugs which shows so much of weakness. Okay, like Carboanimalus, Alumina, Cocculus. Then duration wise, there is two drug which I have got like Causticum and Euphrasia. Like causticum stays for like 1 day and euphrasia is 1 hour or 1 day. Then there is another heading which is better on flow. So better on flow is lachesis, zincum, cyclamen, and macphos. So these are the drugs which is better on flow, and I'll say the worst one is the Simicifuga pulsatilla calicar. So this was the collection which I made it for you guys in order to study, at least in brief we can start it, then we can detail it later on. Okay, so moving on, I'll just say a few lines about each drug so that you can remember that okay, this is the main distinguishing point, so that we can separate it from the rest. If we are not getting the whole totality, but even if we are getting like profuseness of the menses, there are lots of drugs, but what is the peculiarity in that which should be remembered, that when patient comes and we get it in a click. So let's start. Let's start in detail. So first drug I would like to discuss is ammonium mure. In ammonium mure, we'll get menses, diarrhea, vomiting, and blood bowels. Okay, so this is the symptom which the patient will come and complain of, and then we'll think of okay, which drug is there, then there will flow more at night, and we'll get neuralgic pain in feet. So this is the keyword. I'll continually say the keyword. Neuralgic pain in feet is the keyword of ammonium mure. If with the other totalities, if we'll get this, then we should think of ammonium mure. Then there is ammonium carb. So in ammonium carb, we'll see cholera-like symptoms in the commencement of menses, too early, too profuse, too protracted, and preceded by gripping colic. And the most important thing is gripping colic. Okay, and there is acrid menses, which makes the whole thigh sore. Okay, there will be soreness, rawness, okay, burning sensation. Okay, and will get flow more at night and aggravation on sitting. This complaint will be associated with toothache, chilliness, colic, sadness, and yawning. So these 5 things will be there, and fatigueness of the thigh will be there, because there will be soreness, rawness, burning, and there will be fatigueness. So these symptoms corresponds to ammonium carb menstruation symptoms. Moving further to ambragracia. There will be discharge of blood between periods at every little accident or any long walk, like prolonged walking, and after every hard stool. Whenever there is exertion, then there is discharge of blood between periods, and we'll think of ambragracia. Okay. There are Two more drugs which I have discussed, like Sabina is there, and there is Bovista is there, Borex is there. So many drugs are there actually, but we have to think of like every hard stool and all these things. So now moving further to the next drug, that is Actia racemosa. Actia racemosa has irregular and exhausting menses which is being delayed or suppressed by mental emotion, cold, fever, and it is associated with chorea, hysteria or mania with increase of mental symptoms during menses. So this is the keyword. Increase of mental symptoms during menses is the marked feature of active racemosa. Then there will be pain. Pain will be associated with most of the menstrual complaint, but in active racemosa it will be lancinating, electric like pain in various parts of the body, and it is darting from side to side. Like it is not localized, but it is shifting pain. Okay. Moving on to the next drug, that is aconite. In aconite we have studied for the amenorrhea. Okay, in aconite we have studied amenorrhea of young girls with who are very much plethoric. Okay, plethoric in constitution, and how it is being amenorrheic. It was all right just before the fright case. Okay, so whenever there is fright situation, so menses are being suppressed after fright episode. Next, moving on to Pulsatilla. Pulsatilla, we all know, we all are familiar with this drug. That is, we always prescribe this in puberty age menstruation problems. So we can see that there is suppressed menses from getting feet wet. Then the menses are very late, they are very scanty, slimy, painful, irregular, intermittent. So all types of irregularities are present in Pulsatilla. The keyword is there will be pain with chilliness. As I have said in my previous video also, that pain with chilliness is the marked feature with Pulsatilla and suppressed from getting feet wet. So these are the two keywords for Pulsatilla, and there will be pain, restlessness, tossing about. Okay, there will be flow only during the day. Okay, and menarche will be delayed. So the first menstruation will be delayed. Okay, moving on to the next drug. Next drug we see is, we can think of epocinum. Then epocinum is also for young girls like aconite, pulsatilla. Okay, but there will be a difference for dropsical condition. There will be dropsical condition associated with menstruation problem. So where will be the dropsy? It will be in abdomen or it may be in extremities. Okay, metrorrhagia will be there present in epocinum, which will be in continuous form or it may be in paroxysmal form. It may be flowy, it may be fluid, or it may be clotted. So there will be variation. Associated symptoms will be nausea, vomiting, palpitation, pulses will be going fluctuating like quick and feeble. Okay, and she will faint as soon as she will rise her head from the pillow. Okay, so this is the key word, like dropsical situation with the menstruation complaint, and if she faints on rising the head from pillow. Moving on to next, argentum nitricum. There will be metrorrhagia for the young widows. Okay, young widows is the key word. Then there will be sterility and nervous erethism at the change of life. So what is erethism? So nervous erethism means the nervous restlessness, irritability whenever there will be change of life. As in, whenever we do a case taking, then we ask like the various milestones. So milestones is also considered as the change of life. So the patient will be always nervous erethism, nervously irritated at every change of life. Moving on to the next drug is comes Bovista. Bovista is very easy to, I think, distinguish from all the rest because the menses are at night. Okay, just like Mac-carb. Okay, there will be diarrhea before and during menses, like ammonium carb, and it will be occasionally showing of menses like blood just every few days between periods. There will be period, there will be menses, there will be again menses. So between two menses, a little bit of show of blood will be there. So the patient will complain of this, and then we can think of Bovista only when it is at night, and there will be diarrhea before during menses. One more thing should be noted, that every 2 weeks there will be dark clotted blood and accompanying with bearing down sensation. Next, moving on to bryonia. We all have studied bryonia, which is very familiar, and I have studied one symptom which is different from others, that is vicarious menstruation. So what do we mean by vicarious? So vicarious is the key word for bryonia. Rest, all the totality, you have to match whether that drug is coming or not. Just based on this particular keyword, you cannot prescribe the drug, but you can come, like, it is just an indication towards that drug. Always remember this. So in bryonia vicarious, that means when there should be menstruation, the menstruation is not there, but other discharges are prevalent. Okay, so here it is mentioned actually that nosebleed is occurring, so it's clear. The patient will say this complaint. Next, moving on to cactus. Cactus is menses flow ceases on lying down. Other drugs are also there like Bovista and Causticum. So in cactus we see all the symptoms of congestion, like, okay, the patient will complain of like heart is being, congested in a cage. So this is the main keyword for this drug. Okay, and moving on to next is calcarea carb. So calcarea carb, we have all studied it in detail, and it is one of the polycrest remedy for children in fact, but for women and in menstruation it is also helpful, because in menstruation the symptoms it shows is too early, too profuse, too long, too protracted, long lasting, that is protracted. And important keyword, feet is always cold. The person feels like it is, how it is cold and dampness is there, that feels like she is wearing like cold damp stockings, or she is continually in a cold bed. Okay, and next symptom which she may come spontaneously say that there is least mental excitement causes profuse return of the flow. So she is oversensitive, to any sort of external stimulus. Then we can think of calcarea carb. There is too long lasting, too profuse in calcarea carb with a subsequent amenorrheic condition also is seen. Okay, with chlorosis, anemic condition, suppressed and scanty flow is also seen in calcarea carb. Next, moving on to the other drug, that is carboanimelis, which is, we can say that during menstruation, most of the majority of the complaint is seen that it is, the patient is very much weak, very much prostrated. Okay, so in carboanimelis is there so weak she can hardly speak. Two more drugs are there, alumina, cocculus. We can think of these three also. Okay, next, moving on to causticum. Too early, feeble, only in day. So only in day is also for pulsatilla and for causticum, and it also, I have just said now, like causticum, cactus, that seizes on lying down, the menses seizes on lying down. Then we can also think of like lilium, that is also one drug. Next is cocculus. Cocculus is romantic girls with irregular menses. So irregularity is present with weakness. Just like carboanimelis, the cocculus is also scarcely or hardly able to speak or stand in fact. Okay? Next is leucorrhea in place of menses. This is again we can consider in vicarious, but it's not written exactly. So this is cocculus. Important thing, the keyword for this is she will not be able to speak or stand, and next the menses will be like washing of meat. Okay, serum like or chorus will be there, bloody will be there, and this cocculus menses will aggravate on sitting and ameliorate on walking. So this is again a keyword. So three keywords, write it down. Next is conium. In conium, we'll see like feeble, patient, suppressed, and late scanty menses will be there, which is of short duration. But the keyword again is with rashes of small pimples red in color all over the body, which is ceases with the flow. As soon as the flow appears, sorry, as soon as the flow appears, the red pimples stops erupting. Okay, so this is the keyword for conium, and this menses is again stopped by taking cold or putting the hands in cold water. Okay, these two keywords should be remembered in prescribing conium. Next is crocus. In this, only one line is written, that is dysmenorrhea, which is black in color, clotted and stringy. This is the keyword, stringy. So I have said in black colors so many drugs like crocus is there, then it is magmure is there, then muriatic acid, nitric acid and many more. So crocus, there will be black, stringy, clotted, and just reverse is one drug, that is lacaninum. So I'll say just now. Next, moving on to crotalis, that is again we'll see here vicarious menstruation, which will be prolonged metrorrhagia, dark offensive, which I have already mentioned before, and at menopause especially we see these type of symptoms. So this is the keyword again for crotalis. So at menopause will be seen these type of metrorrhagic symptoms, which is intense drenching, perspiration, fainting in fact, and it is like sinking of stomach sensation. So these symptoms which I've said just now, drenching perspiration, fainting, then stomach sinking, all these symptoms are important keywords, and we know the color will be black, dark, offensive. So next drug is cyclamen, which is pale, chlorotic, deranged. The associated symptom will be vomiting, nausea, headache and dim vision. And early profuse black clotted membranous, and these types of symptoms will be there in menses. Important is better during flow. So this will be the keyword, like nausea, vomiting, headache, dim vision, and second one is better during flow. Moving on to euphrasia. It is very painful and regular and lasts for 1 hour. But if it is late, scanty and short, then it will last for 1 day. Okay. In euphrasia, we also see amenorrheic condition with catarrhal symptoms of eyes, nose, which are very acrid in discharge. So this is the keyword again. If amenorrhea symptom comes with catarrhal symptom, then we can think of euphrasia. Next, Ferromet. Ferromet is very much like early, profuse to long lasting discharges and of menses with keyword symptom fiery red face, which is accompanied by ringing in ears, and then it intermits 2 to 3 days and then return. Okay, Ferromet, when you will study, then you will get to know that Ferromet is always alternating 1, 2, black, white, like these things are there. So there will be red, then white, red, pale. So it will be very much debilitating, and the patient will look plethoric even, but they will be anemic. So this is the marked feature and the keyword for Ferromet. Moving on to graphitis. So graphitis, we all know, is given a climacteric phase, just the opposite of pulsatilla. When the woman is fleshy, like fleshy constitution and body physique, and she is mild in nature, and she is having all the characteristics of pulsatilla, and she is towards the age of menopause or climacteric age, then we can think of graphitis. Just similar symptoms of pulsatilla like scanty paleness and late and irregular, intermittent, and even this getting suppressed by getting feet wet, just like pulsatilla. And the morning sickness is also there during menses. So we can think of graphitis. So it's very easy. Next, moving on to hemamelis. In hemamelis, vicarious menstruation, once again, the flow will be dark, profuse, active or passive hemorrhage will be there. There will be soreness in the abdomen, injury in the ovary like fall or any bruise or any type of blunt injury. There will be suffering which will be aggravating during menses. So these all are the keywords, and most important, which is being written only in this drug, jolting while riding over rough road or a ride. So hemamelis is very peculiar. We can think of again, spontaneously we can think of hemamelis, vicarious and jolting. These are the keywords. Next, Helonius. Helonius is the drug which is given in mostly in diabetic condition, but the female who is again suffering from too early, too profuse, too long lasting menses, women is having actually uterine atony. Okay, that means the uterus is not contracting sufficiently. So this leads to enfeebleness by loss of blood when the patient lose more blood than is made in intermenstrual period. So this line is only fixed for Helonius, and if in is asked in examination, is the only drug which is written like these statements. Flow is again passive, dark clotted, profuse. Again moving on to the next drug, that is Ipecac. Ipecac mostly is given in nauseatic condition or in children in respiratory issue, in abdominal issue, but in menstruation also it is being given when there is profuse, clotted and heavy oppressed breathing is associated with the menstruation, and during hemorrhage, and the symptom will be the stitching pain will be coming from navel to uterus. Okay, from navel to uterus, and the reverse is sepia. Okay, from uterus to umbilicus. So this we have to remember, this is the very exceptional drug like that. I have also, when I studied this, I never thought of giving it in, female remedy. Moving on to calicarb. So calicarb feels badly weak, backache, then very much sweating and prostrated during and before and during menses. So this is the calicarb, and there will be chilly, and all the rest of the totality should be taken in consideration. Moving on to creosote. Creosote is too early, profuse, protracted, as we all know, and intermittent and paroxysmal and all these. Important is they cease and commence again, and important again, second keyword is flow is aggravating on lying down, ameliorating on sitting and walking. Pain is aggravating during and after menses, and ameliorating by cold drink. So this is again a peculiar drug, and which will, if we'll ask the patient like these types of, if we are getting all the symptoms like too early, profuse, protracted, and if they are spontaneously telling, oh doctor, this is the modalities, so we can think of creosote. And associated symptoms are there like headache before and during menses, and roaring in the ears, humming in the ears before and during menses. Next, moving on to zincum. In zincum, actually it is mostly given in nervous issue, nervous disease disorders, like when there is lack of stimulus in particular function, when they lack in that, then we think of zincum. In zincum, there is also menstruation point, that it is very weak to start that menstruation. Okay, so we can think of at that time zincum. Okay, and whenever the menses starts, all the sufferings are decreased or ameliorated, and when the menses goes away, again the suffering starts. So all other drugs are also there when menses occur and problems are reduced, is like lachesis is there, cyclamen is there. So we can think of these drugs. So next we can think of lac caninum, that is too early, profuse, gushes, bright red, viscid, stringy. So now this is the keyword. Stringy is again, this is the keyword, just like crocus, but reverse is this. Okay, because crocus was black and stringy, and lac caninum is red stringy. So this is the keyword. Moving on to lachesis. Lachesis is, you'll get it like spontaneously, because the menses will be at regular time. Every time it will be regular and short, scanty and feeble, and pain will be ameliorated by flow. So this is the lachesis, and it's mostly given in climacteric ages, ladies, and there is flashes of heat and hemorrhoids, headache, and all these complaints are associated in lachesis. Okay, moving on to lac defloratum. In lac defloratum, again it is delayed and suppressed by putting hands in cold water, just like conium. And also one more symptom which is very different kind, unique type, like drinking a glass of milk will suppress the flow until the next period. So this is very marked, and this is the only statement written in this drug. Okay, we can relate it with other, but no other significant line given in another other drug. Next is lilium. Lilium is a particular female remedy, and early scanty dark offensive flow is there only when moving about, and ceases to flow when she ceases to walk. Okay, so this is lilium, and important point in lilium is that there is uterine displacement which causes these type of symptoms. So we can think of lilium in these cases. Moving on to magnesium carb, preceded by sore throat. This is the keyword. Then labor like pain, cutting, colic, backache, weakness, chilliness, which is mostly prevalent. Then flow at night. Flow at night. So just like Bovista. And the menstruation is acrid, dark, and pitch like, and difficult to wash off. Magmure. Magmure is menses with great excitement at every period. Okay, flow is again black, clotted, and spasmodic, and pain is aggravated when walking, when doing exertion, any type of, and it is in fact it extends to the thighs. Okay, and then we consider it as metorrhagia, and it is aggravating in night in bed and causing hysteria. Okay, so these are the symptoms of Magmune. It is very different from any other drug. Moving on to Macphos. Macphos is very much used in colic symptoms during menstruation. So Macphos is again early menses, flow, dark, clotted, profuse, and it will be pain characteristics will be the most keyword for this drug. Like stringy pain will be there, darting, shifting, like lightning, shooting like pain will be there, and it will be like as soon as the flow will begin, the pain will reduce, and it is mostly the right sided and amputation by heat and bending double. So they will say that whenever I am applying warm application, then the pain is going away or it is being reduced for a while. So we can think of Macphos. Moving on to medorinum. It is again profuse, dark, clotted, and stain difficult to wash out. So it is intense menstrual colic is present there. So we can think of medorinum, and metrorrhagia in climacteric and profuse for weeks and weeks and gushes on moving, and malignancy of uterus is the important keyword in this medorinum. Moving on to mercurius, the very much important line of the mercurius for the keyword is like instead of menses, milk is coming in breast. Okay, so this is the keyword for mercurius. Moving on to millefolium. This is the drug which is given in most of the condition in PPH conditions, postpartum hemorrhage, and again in menses which is early profuse protracted and suppressed with colic pain in abdomen. Especially it is painless hemorrhage. Okay, no fever. Uterus is affected after labor, abortion, miscarriage, and exertion. So this is about millefolium. So keyword is the painless. Next is nux moschata, that is every menstrual nisus, mouth, throat, tongue, everything will be dry, and especially when sleeping. Okay. Next is leucorrhea is in place of menses. Again, just like cocculus. Next is murex, which is irregular, early profuse, protracted large clots. So important is large clots, murex, and with the other symptoms. Moving on to nux vomica. Nux vomica is too early, too profuse, too long lasting, and keeping on several days longer. Important keyword is complaints at onset and remaining after. So complaint will be remaining thereafter also, onset of the menses, and after that also it will remain. And every 2 weeks, and every time the menses of nux vomica is always irregular. Irregular, never at right time, just opposite of lachesis. Stop and start again, just like sulfur we can compare in this case, and old symptoms actually reoccur, okay, whenever the menses goes away. Now moving on to platina, which I said just like crocus. So too early, too profuse, and too long lasting, and dark clotted offensive. and it is just like crocus. Now next, moving on to podophyllum. So in podophyllum, we see metrorrhagia, which is black clotted, and tardy, which is tarry in grumous mass, just like crocus, as I have said. Next, moving on to the podophyllum, which is suppressed menses in young girls. Okay. Moving on to sabina. Sabina is like too early, too profuse, too protracted, partly fluid, partly clotted, and it is early menarche is there, and flow in paroxysm and with colic and labor like pain, and sacrum to pubis. The pain is always transferring to sacrum to pubis. This is the key word for sabina. Next, moving on to menorrhagia of sabina is climacteric phase, and female who formerly aborted at early first menses, early age she has aborted and early first menses she has seen. So in this case, sabina is being prescribed. Discharge of blood between the period is with sexual excitement is again for sabina indication. Moving on to sickle core. Sickle core is irregular, copious, dark, and pressing pain in the abdomen is the key word, and which is continuing discharge of watery blood until the next period. So this is exhausting and devastating for the patient actually. So sickle core is the keyword, like continually discharging of watery blood until the next period comes in. Next is sepia, that is irregular menses of nearly every form. So we can think of sepia in any of the cases, and we can start in fact with this case, with this drug. Early Ho, late Ho, scanty profuse, menorrhagia, amenorrhea, in every case we can think of sepia. With the other symptoms that the patient should be in chilly in nature actually, and the mental state should be matched. Okay, next, moving further to silesia, which is discharge of blood from vagina every time the child takes her breast. So this is the discharge of blood during feeding the baby. So this is one, again the red line symptom for silesia, which should be remembered during menstruation topic. Moving on to sternum, which is too early, too profuse, and sadness before pain, sadness before menses, and pain in the malar bone. Moving on to next, that is important is sulfur. So in sulfur we see that too early, profuse, protracted menses is there. With important line is that the patient will say that she has not been well since last miscarriage. This is proved by Adolf Lippi, who has given a single dose of silesia in new moon time, and the result was in front of him. The patient was obviously recovered. Next is tarantula, that is for every menstrual nisus there will be again throat, mouth, tongue will be dry just like nux moscata. Moving on to the next drug, that is tuberculina. It is too early, too profuse, too long lasting, tardy in starting. So the keyword is tardy in starting, with dysmenorrhea and frightfulness. There must be history of tuberculosis or any tuberculous patient in his or her family, obviously her family. Next, trillium pendulum, the drug is, in this again there is 2 weeks. 2 weeks is important, the keyword. So it every 2 weeks is it comes and it lasts for a week. Every 2 weeks it comes and lasts for a week or longer. In fact, that we can think of Calcadia Falls also in this because it's written. And again it will be increased by over exertion or riding for too long. Riding for too long. Menorrhagia is again very much profuse and gushing. So keyword is gushing, which is brightened, and fainting. Fainting is also present in trillium. So this is the most important keyword. At least movement and will displace the uterus, and displacement will be seen, and then will be dark clotted menses. Moving on to Thalspi. So Thalspi bursa pastoris is the drug which I would like to conclude it. That is, the menses will be as usual dark, clotted, and too early, too profuse. But it will be long lasting for how many days? It will be long lasting for 8, 10, 15 days. Okay. Starting it will be tardy again. Okay. But the second day, the colic, vomiting, hemorrhage, large clots, all will be seen. So the patient will be terrible from the next day. Okay. So each alternate period will be more profuse. So this is the keyword. Delaying menses, uterine inertia is there, exhausting, and scarcely over from one period, the next period comes over. and what happens, the patient is again terrible. And this is the only drug I think I have seen this line is mentioned. So we can think of Thalspi, we should think of Thalspi in fact in order to start the treatment with. And there will be, whenever the patient will be suffering from metrorrhagia or menses which will be profused or clotted, there will be violent cramps and colics will be present, and chlorosis, and after abortional labor, miscarriage, and climacteric phase with important line, cancer uteri. We can think of this drug, and we should think of this drug in cancer uteri. Okay, so that's all for today, and I hope you enjoyed this long session. But I will be coming with the next video, next topic just for you guys. Until then, bye bye, and thank you for watching. And if you have liked this video, please do like, thumbs up, and share, comment, and subscribe. Thank you.